Okay, so hopefully everyone can see my screen. Give it a second. So same as usual, if you're not with the schools or health department, we'll ask you to drop off, then watch your health department website for a transcript and the slides. Pass along any needed information to those who need it within your system. First thing I wanted to share was just a reminder that the CDC does have a nice tool available. Typical of CDC, you kind of have to hunt for it to find it, but it is on their diagnostic testing page, their community or their public testing page, not their healthcare provider page. But it's in a box that looks like this. It says viral testing tool on it. And if you hit get started, it'll ask just if you agree or disagree, to not consider it medical advice. And it will ask some things like if you've tested positive recently, what kind of test you had, if you have symptoms, if you are close contact, if you've been in any large group activities, which I would consider attending school a group activity, what county you live in, because it takes into consideration your community transmission rate. But it does a pretty decent job of telling you then what to do, whether you should consider it a true positive, or you may want to consider getting a confirmatory PCR, things like that. So if you aren't quite sure what to do with a student's test result or staff members or your own, that is a nice tool to help you work through it. It tends to recommend confirmatory PCR a little less often than what we might have traditionally done, but by taking into consideration activities, exposures, and community transmission rates, it may consider a positive, more likely a positive, and things like that. So again, that is a nice, useful tool. I also put a link in here. I know it's a really long link, but once you get the slides, you can use the live link there. But that's a nice explanation for individuals, whether they get tested at home or they've been tested out at a community site by rapid antigen testing, kind of walks through how to handle those test results as well. I just became aware of this study today from another medical director in the state. It was just published about a week ago. Iowa is a state that pretty early on last year started allowing students to defer quarantine if they were fully masked at the time of exposure. So if both the sick student and the contact were both fully masked. And their evidence is what I used a lot to base my modified quarantine guidance on. They just had another study published where they looked at non-household contacts, so those that were not exposed in the household, to confirmed cases, and they only looked at people where they knew what their masking habits were when they were exposed, and they had testing data. So, really good quality data. So they had 431 cases that they looked at and 966 close contacts associated with that, which again, they knew what their masking status was, and all those close contacts were tested. The table or the image here on the slide is the ages of the people in the study, the close contacts in the study. As you can see, the majority of them were younger. So while they don't really specify if they were in school contacts or not, most of them were school-aged children. Overall, and I have a table here in just a minute, but overall, the secondary attack rate, which they abbreviate SAR, which means the number of close contacts that became positive or infected, was 20.5%. So overall, masked, unmasked, whatever, about 1 in 5 close contacts became infected. When they looked at I'll just go to the table. It's a little easier to explain. So in situations where one or both people weren't masked, so whether it was the sick person or the exposed person were not masked, 25% of the time the close contact got infected, so about 1 in 4 times the close contact got infected. If both were not masked, so the sick person and the close contact were not masked, it was 26% of the close contacts got infected. If the sick person was not masked and the close contact was masked, only 10% of the time did the close contact get infected. Now, these are some smaller groups of people. As you'll notice, they only had like 40 people in this study arm because it just got to be smaller people. In situations where the sick person was masked, but the close contact was unmasked, for whatever reason, it went up to 29% of the close contacts got infected. So it almost appears that the mask protects the person wearing it from infection more than preventing disease coming from the sick person. But again, these are very small numbers. If both individuals were masked, the infected and the close contact, 12.5% of the close contacts got infected. And then when they didn't really know, it was about a quarter of the people got infected. So when they looked just at the school age kids, when they had one or the other or both of them unmasked, again, about 1 in 4 got infected of the close contacts. And when they were both masked, only 12%. So cut it about in half. The other thing they looked at during their study period is when the CDC said you could reduce quarantine time down to 10 days or 7 days with a negative test. So they looked at when people did test positive. As you can see, there were smaller percentages, but there were individuals who did test positive at 8 days or later. When they looked at how many would have been missed by releasing them after 7 days if they tested negative with no symptoms, or releasing them after 10 days if they had no symptoms, 3% of cases would have been missed if they were released at 7 days with a negative test, and 5.6% would have been missed at 10 days if released based on the absence of symptoms. So just an FYI on that, that kind of goes along with the estimates that have been given in the past, just a reminder that those shortened quarantines are not risk-free. But I just wanted to share this data because it actually is good data, much better, because the issue is always that, you know, you don't test everybody, so it's hard to know who's really getting infected. So anyway, the rest of this, for this next little bit here, I found I don't know how I have not found this website before, but it's called healthdata.org. It's a really good data site that's run by the University of Washington. This is they do state reports in the US and different countries. This one's from the state report for Michigan for this last week, going through October 21st. So I'm just going to go through it pretty quickly, but just so you know that that's there and if you're interested. So basically saying that for the prior week, COVID was the second leading cause of death in the state of Michigan after basically heart attacks. This shows the total cumulative deaths from COVID, the rate per population for states. So Michigan is in that 250 to 299. So there are obviously some states doing worse than us, but we're definitely not the best in terms of death rate from COVID. This is the death rate per infection. So basically about 6 to 8 people out of every 1,000 that are getting infected with COVID are dying. It's obviously not adjusted by age or anything, but you know, we're certainly not in we're not where we would like to be. Unfortunately, in my opinion, too high of a percentage of people with COVID are dying in Michigan. So the estimated percentage of Michiganders that are infected with COVID as of October 18th was around 30%. We may not have all those tested, but it's just an estimation. And then the R, some of you may have heard of the R naught or the R factor for an infection. That's how quickly it's spreading. So how many people does an infected person spread it to? So I had looked at this last week and we were higher last week, so that's good. It's slowing down. But it basically means for every person infected, they're spreading it to about one more additional person, or just a little more. We won't see rates going down until that number is less than 1. Luckily, it's not over 1, because when it's over 1, you're going to still see rapidly increasing rates. So, so hopefully we'll get into the blue color soon. This just shows what amount of our COVID infections do they estimate are actually being found by testing. So in Michigan, we're just about 60% or so. Certainly, we're higher than some other states. I just throw up a few others here for comparison. But just a reminder that, a good portion of our COVID infections are not diagnosed or not known. This is an estimate or a trend in our mobility using people's smartphone GIS systems. Just interesting, again, compared to just some random other states. We're one of the more mobile states compared to others. And, as you know, as you move more, you move the disease more. Mask use, Michigan is one of the lower percentages for mask use in the country. This shows it compared specifically to some other states, and compared to Florida, New York, Texas, and California, our state's mask use is much lower. And, we really bottomed out after the orders were ended and have just not really picked up from there. This is this university's estimations for where we're headed. The worst case scenario, this pink line, they're basically saying that everyone who's fully vaccinated stops wearing masks. We become even more mobile than we were before the pandemic started. And so not a likely thing to happen. The green line is the most likely scenario. That's where we keep vaccinating at about the same rate we're going, which isn't that much right now. Our mask use continues as it is, and people, as they get more vaccinated, get more mobile, but basically it's just status quo. And the universal mask scenario assumes that 95% of the population starts wearing masks. So according to this, their expectation is that our infection would peak around December, which I don't really like that. And then hospitalizations and deaths tend to lag a bit behind infection rates. So hospitalizations would be more towards late December, January, and deaths, same thing. But with masking, we expect to see transmissions cut by about a third or so. But we just have seen that really fall off in Michigan. Another report that came out, this is kind of a downer, but just something of consideration with our school-age kids that we may not think about as much. For you guys, you may have had this, very intimately aware in your school-age kids, but just within the first 15 months of the pandemic, over 140,000 kids in the U.S. lost one of their primary caregivers due to COVID, and throughout the world, about 1.5 million kids lost their primary or secondary caregiver. So, I share this just so you have talking points if you need them, but it's not really statistically showing up right now, but it just seems like we're getting some younger and younger deaths reported to us, and I worry about kids losing parents and also grandparents that help take care of them. So now moving into our usual data, as usual, you can go to mystartmap.info for your county data, but the information you can't really find on your own is your school age kids in your area. In the 19 counties that are on this call, this is our 5 to 18-year-olds. For this past week compared to the comparable week a year ago, this does hopefully seem to be leveling off. I'll go through each county separately, but just a reminder that the values on the y-axis are different for each county, just because there are different amounts of cases. So first, the counties in Central Michigan District Health Department. Here is Aranac, Clare, Gladwin, Isabella, Osceola, Roscommon, and then the 3 counties of Mid-Michigan District Health Department. First is Clinton, Gratiot, Montcalm, then District 10, Crawford, Kalkaska, Lake, Manistee, Mason, Mecosta, Misaki, Nuevo, Oceana, Wexford. So the data and modeling update from the state for this week, all of Michigan is continuing to be in a high transmission rate. Our percent positivity is just 1/10% higher at 11.4% overall. Much of our area is quite a bit higher than that, however, but the highest for the state was 11.5% on the 16th. Our case rate is down a bit, but still at 312.8 cases per million. Inpatient bed use from COVID is up and death rate is up. And there were 280 COVID deaths between the 12th and 18th. So here is the state as a whole, but again, hopefully a downward trend. So the daily case rate, again, may be trending downward. The positivity rate seems pretty stable. And the hospital bed occupancy and deaths are pretty stable. Again, those tend to lag behind the case rate because people usually get worse later after their diagnosis and tend to die later after their diagnosis. So our 10 through 19-year-olds tend to continue to be the highest case rate age group, but hopefully we're starting to see things slow down a bit, knock on wood. This is the hospitalization rate, or actually not rate, it's the absolute number of hospitalized kiddos in the state. I pulled numbers today. Region 6, which includes a large amount of our counties, but also does include Muskegon and Kent County, which I know are high population counties. They reported 14 pediatric hospitalizations, which usually it's low single digits. So I don't know if that's an error or if really they are seeing that big of numbers of pediatric COVID hospitalizations. Region 3, which also includes some larger counties, did also see a little bit of an increase. ER visits for diagnosed COVID may be starting to trend down, hopefully, because they've been pretty overloaded with lots of coughs and colds lately. Hospitalization trends, again, just continue to kind of putz upward here, and the ICU trends as well. So hopefully that will start coming down soon. The outbreaks overall went up about 5%, but there was actually a slight decrease in the number of new school outbreaks reported. So hopefully, I'm just going to go right to the graphs because they're a little more meaningful. So, we continue to have those ongoing outbreaks kind of keep getting added to over time. But the new outbreaks did drop down just a little bit. And the cases associated with outbreaks, with the new outbreaks, again, went down. This last slide, just in case people have heard about it, this new Delta Plus variant. Plus does not really mean that it's anything worse or better or anything like that. It's just Delta variant, which is essentially all of COVID right now that we're experiencing in Michigan is the Delta variant. It just has some additional mutations in it. It is being found in the UK. We really have not seen much at all in the US or Michigan. It's less than 0.5% of all the sequencing that's been done in the US recently. So that is something on the radar, but just in case you read news about that, I just wanted to give you that information. So that is what I have for today. All right, so I'm going to go to questions and answers. The first question, I mentioned to avoid shared equipment. Does this include, oh, that was last week, I'm sorry. All right, I've heard from multiple parents that when they have contacted doctors' offices about getting a PCR test, they have been informed that students must have symptoms for 4 to 5 days before being tested. Is this true? If so, where did this come from? And how do we go about correcting the practice? So I have not heard that. I do know after exposure, it can take some time for the PCR test to become positive, but once they're having symptoms, they would be positive. If you can let me know either in the chat or you can email me what area that seems to be a problem in, like if there's specific doctor's offices or what county, what area that is, we can work on education. Or if they can maybe be directed to places where they don't need a doctor's office, a doctor's order. But there are times where we do need to just re-educate healthcare providers, and we want to make sure we're educating the right groups. Struggles with parents getting 2 different return dates, one from the HRAs that are honoring the district policies and guidelines, and 2 from the health department close contact calls, giving them the dates the health department is recommending. How can we prevent this added stress on families and the school administrators? And that one, you may have to talk to your local county nurse about that. But for those that are counties that are using TraceForce, which is the state system, there is a way for them to indicate that it is a school exposure so that the letter that they get is more vague and just says, all schools do something different and the return date you get may be different so that it's not as confusing. So again, since I'm talking to 19 counties right now, it's a little bit tricky for me to give you a specific answer on how to fix that. So I'd encourage you to talk to your local county health department COVID contact about that. So Aranac, okay. So Aranac County was the one with the medical providers. So we'll try to work on that, educating them about the PCR tests. And Oscoda or Iosco counties, that's not in my jurisdiction, but I can talk to the medical director that does cover that county and see what we can do about it. That was all the questions Morse. I have in the chat. Yeah.
I was the one who asked the question. Part of the challenge, and I can't be the only person who's dealing with this, is, yeah, I know Iosco's in a different health department, but they're literally the border county with me, and a lot of our people end up going to that county for testing because you might be able to get there quicker, or that's where their family doctor is because we're that close. And I know we can't be the only one, but that the messaging between the health departments being as close to the same as possible would be very helpful for our border counties.
Oh, yeah, yep. And I'll talk to the medical director from that county so that we can figure out where the messaging is coming from, if it's the healthcare system, because that healthcare system is one I don't work with very often. So, but yeah, I think it's Mark Hammond that's the medical director over there. I think I'll figure it out. And then returning Gratiot County with the different dates. We actually did discuss that earlier this week, and it should be rectified. You know, again, it had to do with checking a certain box with Trace Force, and so going forward, that should be fixed. I want to verify the rules for home exposure. What are the quarantine testing options for a student who has been exposed in their home? So with those, with a household exposure, because that is such a high risk for infection, they do need to quarantine as usual. We do allow for the 10-day quarantine as long as they're not having symptoms. They can return after 10 days. So that really is the 10 to 14-day quarantine is the option there. Any other questions? What about when a parent knows they are positive but hasn't actually tested positive? Can we require the student to quarantine? Parent refuses to test. You know, legally, if you suspect that a student could have or be carrying a communicable disease, you have the authority to quarantine them. It gets a little bit dicey though, when you don't have proof of that. So, I mean, we can talk more offline if we need to, but I know it gets really difficult. Are there any legal issues having school staff do the swab testing versus a healthcare provider or a non-clinical HRA? I'm assuming you mean having the school staff performing the testing, and you know, as long as they do on the MDHHS website, if you go under resources, you'll see the school section. They have training on there, they have waivers, they have everything you need. And as long as you do all of that appropriately, there should not be any legal issues whatsoever. There is contact information to talk with MDHHS if you have any concerns with that. But really there should not be any concerns. Unless there's just like gross negligence, like someone just doesn't know what they're doing and injures a student from incompetence. But, you know, that's not going to happen. Any other questions? All right. Well, I know it's been probably the longest few months of everybody's lives. So I appreciate all of you and all that you do. I will follow up on the Iosco County situation. And if you guys have other questions, let us know. But otherwise, we will talk again next week. We'll get this information out to you and posted to the websites. So,
Dr. Morse, just to clarify,
yeah.
It's Aranac and Iosco County.
Yes. Yep.
Okay. All right. Thank you.
Yep.